After 4 years of study, there have been observations of slowing the progression of dementia with the use of memory attainment services. As you can see in the chart, most patients in our units suffer from Alzheimer's disease and dementia. Memory attainment services may initially contribute to the entertainment of these people, but at the same time also play a significant role in the strengthening of speech and movement. Moving along, we have included a sample of the annual development charts that we keep for the past year for 2 dementia patients. With a scale from 0 to 100, we see in these charts the course and the evolution of these people who undergo the services in our units. The first diagram is the annual performance of a male dementia patient doing the memory attainment services. As you can see in the first month, when he began to do the services, the level in his mood, speech, and movement was exceptionally low. Of course, gradually and over the next month, the next 11 months, as you can see, his state of health was improved. More specifically, within a month from February of 21 until March 21, his mood increased exponentially. At the moment, this person can participate in a dialogue, walk with some help, and all this while being in a good mood. Next, we have the annual performance diagram of a dementia female patient who also undergoes the memory attainment services. When this patient began our services in October of 20, she was at a better level of speech, movement, and mood compared to the male patient that we analyzed above. Nevertheless, there was an improvement in all 3 variables, which we are interested in and we examined. So far, we have realized that memory attainment services can help people with dementia. Some patients show greater improvement, while others can maintain and develop their mood, speech, and movement at a level that does not negatively affect their quality of daily life. A very significant assumption is that the memory attainment services are addressed and geared towards all levels of ability, since they can be used either to confront upper or lower limb problems or hearing or vision problems. Nonetheless, we continuously develop innovative approaches aiming at diminishing the obstacles and restrictions of the pandemic. Our main concern is the maintenance of the levels of dementia to the minimum through our innovative assistive technology services adjusted to a personalized session program for everyone. However, living in an advanced technological era where artificial intelligence is essential and is presently advancing, we look forward to developing and advancing our services in the near future with artificial intelligence additions.
Thank you very much for this presentation. First, I have a question about your service you have developed for care units. Was this more in the nursing home setting, or were there different settings in the community you have developed these services?
Services can be applied to any settings. However, as a team, we practice them in the family-owned business, which has 2 elderly care units. And that's our ground of study at the moment. Well, for the past 4 years that we have been doing them.
And is it for all stages for dementia, or is it at the beginning now more for the milder stages?
Correct. It's more for the early stages and mild stages. People that cannot react, they don't have, they're incapable of reacting. There's no ground of performing these services, such as the gastronomy memory. It's something that needs to be, that needs to include movement. So people who don't move or they cannot use their hands, of course they cannot do it.
Mm-hmm. So I think it's very good to have different types of services for the people with dementia, because for everyone a different type is very interesting, and also sometimes the mix of different.
Correct.
So, I think it's very interesting.
We do mix the back service, if you see, with the virtual reality, with the mask. And it's very interesting to combine both. Yes, we do have, we mix the services together.
Mm-hmm. So then good luck for the next future and for the next developments.
We look forward, yes, to developing more services.
That's perfect. So I thank you very much for this very interesting presentation.
Thank you for having us and giving us this opportunity.
Bye-bye.
Bye-bye.
Για να συμμετέχετε σε ένα ευρύτερο στόχο ενημέρωσης και αλληλεπίδρασης με άτομα παγκοσμίως για θέματα που αφορούν τις προκλήσεις των ανιακών και συγγενών παθήσεων και την αντιμετώπιση τους, κάντε subscribe, εγγραφή, πατήστε like και καμπανάκι για να γίνετε μέρος της Memory Team and Community, μιας ευρύτερης κοινότητας με εξαιρετικό σκοπό.